Paget's disease, an osteolytic and osteosclerotic bone disease of unknown etiology, also having an evidence to be a form of slow virus infection by paramyxovirus. Hello everyone, this is Rahul and welcome to our channel doctorsbe. So the outline for the discussion of the topic Paget's disease is as follows. We shall first discuss about the introduction of the disease, then we shall discuss about the pathogenesis of the disease. After pathogenesis, we will discuss the clinical forms, then morphology, and some figures to explain the morphology stages in the morphological stages. Okay, so we have discussed about the introduction to the disease, we discussed about the pathogenesis and the clinical forms in the previous video, that is Paget's disease part 1. If you have not watched the video, you can find it in the I button and on the playlist Paget's disease. So in this video we will be focused on the morphology and the three identified stages and figures of those stages which will help us to understand the stage. So the video not only aims to understand the core of the topic but also to express it in your answer sheet. Morphology, it mainly involves pelvis and tibia, and we have three identified stages, and those stages, we have three stages, and the stages are initial osteolytic stage, mixed osteolytic and osteosclerotic stage, and the final osteosclerotic stage. First and the foremost, initial osteolytic stage. So always it is obvious that if it is an osteolytic stage, there will be the increased number of osteoclasts, because they are responsible for osteoclastic activity. They are responsible for the osteolytic or bone resorption. Yes or no? So there will be increased number of osteoclasts, which will result in increased areas of osteoclastic bone resorption. Increase in number of osteoclasts will increase osteoclastic bone resorption. Yes or no? The second one, mixed osteolytic and osteosclerotic. Osteolytic and osteosclerotic. And osteosclerotic stage. And if it is mixed, it is obvious that there is both involvement of osteoclastic and osteolytic activity, osteosclerotic and osteolytic activity. But in addition to involvement of the both osteolytic and osteosclerotic stages or activities, there is imbalance between these two activities. So imbalance between osteolytic and osteosclerotic stage and The due to this imbalance between the osteolytic and osteosclerotic stage, we have two major consequences due to and they are the newly laid matrix. The newly laid matrix is not calcified or not mineralized. Okay, is not mineralized. These are mainly these are the characters of the mixed osteolytic and osteosclerotic stage. Okay, so the first one is the imbalance. There is an imbalance between osteolytic and osteosclerotic stage. The second character or second point in the characters is that newly laid matrix is not mineralized. Okay, and third point comes, and it is that the area, okay, the narrow space, rather than area, the space will be a better word. This narrow space between the cortex and the trabeculae gets filled by collagen and becomes avascular. Okay, narrow space between, I'm writing in short form, okay, between cortex and trabeculae is filled by collagen, making it avascular. And radiologically this stage, okay, mixed osteolytic and osteosclerotic stage is seen as jigsaw puzzle. Okay, seen as jigsaw. This is the radiological point, the radiological appearance. Okay, it is seen as a jigsaw puzzle. Radiologically it is seen as a jigsaw puzzle. Okay, and first the peculiarities. So the major peculiarity is imbalance between the osteosclerotic and osteolytic stage, osteolytic activity. Okay, osteolyte and activity, and the newly laid matrix is not mineralized. Narrow space between the cortex and the trabeculae is filled by collagen, making it avascular. And radiologically this stage, mixed osteolytic and osteosclerotic stage, is seen as a jigsaw puzzle. Okay, so now the final osteosclerotic stage. In this stage, the bone becomes more dense. Okay, the bone becomes more dense, compact due to excessive bone formation. Bone becomes more dense due to excessive bone formation. So you must be thinking that it's good to have more dense bone because it will be strong, but it's not like that. The bone becomes more and more susceptible to fractures. Okay, formation, and it's not that the dense bone will be a stronger bone. The bone becomes susceptible to fracture. Okay, it's not that it will become much stronger, more stronger, but instead of that it becomes susceptible to fractures. Okay, fractures. And radiologically this stage is seen as a cotton wool appearance. Okay, radiologically the appearance of this stage is a cotton wool appearance. radiologically. This is a diagrammatic representation of the three stages, trying to make you clear about the stages. So this one, first A is the initial osteolytic stage, where there are the areas of bone resorption, osteoclastic bone resorption, and these are the osteoclasts. And while writing about the points, we mentioned A is the initial osteolytic. Okay, so osteolytic stage, don't get confused, this is the osteolytic stage. Then coming to the second, the mixed, or B1, the mixed osteolytic and osteosclerotic stage. Here this the osteoclasts are showing the areas of osteoclastic bone resorption, and the osteoblasts, these are the osteoblasts. Osteoblast laying down new lamellae of the bone, which forms the compact bone later on after being mineralized. So these are laying down the bone, laying down new bone. Okay, the osteoblasts are laying down new bone, whereas the osteoclasts are busy doing the bone resorption, busy in bone resorption. So this is showing the osteoclastic areas of osteoclastic bone resorption. Here is completely only osteolytic stage. Here is the mixed one, osteoclastic and osteoblastic activity. Yes or no? So here is the bone, the osteoblasts are laying down the new bones, whereas here the bone resorption is taking place by the action of osteoclast or osteoclastic activity. Then we have the final osteosclerotic stage, where the bone becomes hardened. Yes or not? Where the bone becomes more dense due to excessive bone formation, excessive bone formation. These areas are showing excessive bone formation. Okay, and it is susceptible to fractures. So these are the diagrammatic representation of the three stages, trying to explain in a little bit of detail, and that we wrote the same thing. These figures say the same thing that we wrote a moment ago, and drawing these figures will help or build up a good impression on the people or on the teacher who is supervising your paper, who is supervising your answer sheet, and may help you to get some extra marks or a good marks. So these are the osteoblasts. Okay, and this area are showing the excessive bone formation area. So here we end the topic Paget's disease, and if you like the video, subscribe to the channel would help it grow. And any queries, you can write it down on the comment section, or you can contact through the Gmail which is provided in the description. And if you have not copied these things or not note down, you can find the notes in our Facebook page. The link to the note or the Facebook page, the post is given in the description, so you can check it out if you have not copied these things. So once again, A is initial osteolytic stage, B is the mixed osteoblastic and osteosclerotic and osteolytic stage. Yes or no? And the C is the final osteosclerotic stage. Okay, so hope you understood the concept and you would reproduce it in an exam. See you in the next video. Till then, take care.